All right, we are going to get started. We are talking today on what we know so far about COVID-19 and planning for the future. My name is Dr. Valda Crowder, and people call me Dr. V. For those of you who have not been on this webinar before, I'm an emergency medicine physician, and I've been an emergency medicine physician for 30 years. And I have treated patients across 4 pandemics and 2 Category 5 hurricanes. You can see the source material for these slides on AskDrV.us, and you can also follow me on Twitter. All these presentations, they change from week to week. Usually Tuesday and Thursday are somewhat similar presentations, but they change from week to week as information comes out that's new. The structure of the webinar is a 10 to 15 minute slide presentation, then followed by Q&A. And we usually end by 9 o'clock. During the presentation, everyone is in listen mode, and you can put in questions using the chat box, or you can also put in questions in the Q&A. I will take written questions first, and if you have a question that you think about later, you can also email me, and I will include that in the presentation or have the information ready for by the following week. All right, so the goal is to keep participants informed about COVID-19 so that you can help you and your family stay healthy during this pandemic. You'll leave the webinar motivated to create an action plan or modify an action plan. And some people are creating an action plan for a broader community like a union or a school or a workplace. All right, so we talked a little bit about the fact that pandemics impact world leaders. This just shows world leaders that were impacted by smallpox. We've had similar world leaders impacted by COVID-19. And then this week, we also had our president impacted by COVID-19 and several people pretty high up in the Pentagon and also in the White House. So as I remind people all the time, it's important to respect COVID-19. It's highly contagious. It really only takes about 45 seconds of exposure to infect others. So it's very, very efficient. The other thing too is that if 100 people get exposed to it, 60 to 80% of them will come back positive. So it transmits very, very efficiently. It operates as both a droplet and an airborne disease. Originally, we thought it was just a droplet disease, which is why we had people stay 3 feet away from each other. An airborne disease can travel farther. And I'm just going to show you just a demonstration of sort of what that looks like. The red is droplet, like Ebola, and the gray is airborne, like measles, right? So if you look at that, you can see all of the things that might be in the person's path that actually get contaminated. So if you actually look at the event that they're calling the super spreader event that was in the White House, and you take that into consideration, then you can kind of see how the people then became positive. Now, it's unclear whether or not the actual spreading event was this outdoor event, or was it the receptions that occurred previous? So the photo taking and the receptions that were indoors. So this is some examples and some photos of some of the things that occurred indoors prior to the outdoor event. So the spreading could have easily happened in these environments. Now, all right, what do you need to know specifically about how to get tested? What are all the different tests that you see people talking about? The diagnosis is made one of 3 ways: by PCR testing, antigen testing, or CAT scan. The PCR test is the test where most people say it's very uncomfortable. They actually, put the swab pretty far down your nose. That is the most accurate test. The antigen test is the rapid test. that has a false negative about 20 to 30% of the time. So if it's positive, it's true. But if it's negative, it may not be true. And so what we do in medicine is we actually say that someone is negative when they've had 2 negative rapid tests. The other way to diagnose is by CT findings. And basically what you see is sort of like a ground glass opacity or linear opacities on a CAT scan. That actually shows that someone has viral pneumonia related to COVID. All right, so now let's talk about the president's symptoms, which were coughing, shortness of breath, and fatigue. We talked about the 6 different clusters, right? And these clusters help predict the severity of COVID. So clusters 1, 2, and 3, 1 and 2 are flu-like symptoms without fatigue. 3 is nausea, vomiting, diarrhea. So clusters 1, 2, and 3 usually are very self-limited, and they do fine at home. Cluster 4 is the one that President Trump has, which is the one that's associated with fatigue. You can also have cluster 5, which involves confusion. And then you can get cluster 6, which involves all of the symptoms together. So 4, 5, and 6 are the ones that usually require hospitalization. And this disease is not, it's not a linear disease. So people, it kind of waxes and wanes. So you can begin to feel better and then get worse and then begin to feel better and then get worse. That's basically how this disease sort of operates. The treatment that the president had was pulse ox was used, and his oxygenation was low, and then he was given oxygen, supplemental oxygen, which I think he's still getting, vitamin D, zinc, famotidine, dexamethasone or Decadron. That is actually used for with people that have viral pneumonia, remdesivir, and Regeneron. And Regeneron is not the name of the medication. I know they've been Regeneron is actually the name of the company, but let's go over a couple of these things. So famotidine is Pepcid AC. So you find this in the drugstore, but this can be given IV or by mouth. It blocks histamine release. It's been associated with lower hospital deaths and also lower combined death and intubation. Decadron or dexamethasone is a steroid. That steroid also decreases inflammation and has had a lower 28-day death rate for patients that either require oxygen or ventilator. Remdesivir is an antiviral medication. It was initially developed to treat hepatitis C and RSV, which is called respiratory syncytial virus. But remdesivir, what remdesivir does is it blocks the replication of the virus. So what happens is the virus comes into a cell, usually a cell in your lungs, right? And it releases this genetic code, as you can see over here in the second picture. Then what happens is that genetic code becomes viral proteins. And then those viral proteins, they make copies and copies and copies and copies and copies, right? So then you have a new virus assembled in this cell. And this is how a virus spreads. So remdesivir, what it does is it blocks the replication of the virus so that it's not making copies and copies inside your body. Regeneron is the name of the company. When these experimental drugs are initially tested, they don't have a name. So usually they might have a number or a series of letters or numbers to identify it. They just call this one antibody cocktail. So basically, there's 2 antibodies, monoclonal antibodies. One is actually from a human that has recovered from COVID-19. And the second is from a mouse engineered to have an immune system like a human. And so both of these actually bind to the main surface spike protein that helps the virus attach to the receptor on the human cells. So this antibody is really important in providing immunity, which doesn't allow that that virus to actually enter into the cell. Now, there's been talks about serum markers. I'm just going to go over a couple of the serum markers. They were asking for information on the serum markers, but just so you know what they are, when they talk about serum markers, white blood cell count tells you whether or not you have an infection. That should be high. Lymphocyte count is a type of white blood cell. That's usually low. C-reactive protein actually tells you how much inflammation do you actually have. That's high because there's a lot of inflammation. Procalcitonin levels, another serum marker that's high. D-dimer, this is probably one of the most important markers. This is high normally in COVID, but what a D-dimer tells you is there a clotting problem? So we're seeing with COVID-19 a lot of strokes, heart attacks, sudden death, and usually the D-dimers in those patients are high. Now, with the meeting with the fans, I think this is important, and I tell people to really look more at the people in the front seat, the Secret Service folks, and look at what they're dressed in. If you're around someone with COVID-19 who's known to be positive, right, the amount of PPE that you have to have on is significant. So in that car, the person that's sitting in the front, they have on a little yellow gown and a mask, and maybe it looks like either goggles or a face shield. That is inadequate PPE to actually be around somebody who is known COVID-19 positive. Let me show you what you should have if you're going into an environment where someone is known to be COVID-19 positive. So normally they put on the mask. There's usually also something that covers the hair. Now you'll notice this gown is blue. This is a surgical gown, which is blue, and it's much thicker than that yellow flimsy see-through gown. Now they're putting on their gloves. Their shoe coverings, because again, these particles can, they drop to the floor. And then this is a Tyvek suit that you then put over everything. It zips up in the front. Some of them have a hoodie on them. Those are another set of booties that kind of go over the an outer layer of booties. That's what she's putting on now. And then a hairnet over. The layering is important so that way you don't have any areas that are exposed. And another set of gloves that then will go over the first set. and then she's putting another mask on. All right, and then usually over that, there will be some sort of either goggles or a face shield. Yep, there we go. There are the goggles and the face shield. Right. And that's sort of what that looks like. So as you can see, you know, the Secret Service folks are really, really in danger not having adequate PPE. All right, so now if you found out that you became COVID-19 positive, what should you do? One is you quarantine immediately, preferably for 21 days. I know people have been saying 14 days, and some people have been saying 10 days. In Wa, Italy, they found that people still were positive after 14 days. About 6% of the people were still positive. So if you can get a test and confirm that you're negative and get 2 tests separated by 24 hours, that's great. But if not, best to quarantine for 21 days. It's important to have a pulse ox. There's a picture of one there on the right-hand side. The zinc and the vitamin D3, the dosages are there that people should take. You want to make sure you have access to a bathroom that will only be used by you. You want to have a cell phone so that you can call for help. If you're calling for help, you're calling 911. You're not calling a family member because you don't want to get a family member infected. And you want to keep the windows open and possibly have a HEPA filter. All right, just a couple of things that I saw on the news that I thought was very interesting, and I want us to start thinking about the holidays and how to do the holidays differently this year. So Dr. Fauci's daughters said that they're not going to come to visit him on Thanksgiving as they normally would because they want to protect their father. And so, you know, we all have things that we would ordinarily be doing in life, whether or not they're weddings, funerals, Thanksgiving, Christmas, and you really want to, you know, until we are able to get vaccinated, really rethink those things and really come up with a plan for being in this pandemic. There's a New York Times COVID-19 tracker. And it's been showing that there is an uptick. We've been usually around 35 to 40,000 cases a day. We are now upticking to like 52,000 cases a day. And again, with the states that are having the most COVID outbreaks, Wisconsin is really, really having problems. Wisconsin is the new hot spot. And then you also have the other states, North Dakota, South Dakota, Oklahoma, Montana, Iowa, Wyoming, etc. New England Journal of Medicine actually has never, ever, ever done this. This article, this is an editorial. So all of the editors, the physician editors got together and wrote this. They talk about dying in a leadership vacuum. And basically, for the first time in its history, the New England Journal of Medicine is recommending that people vote for Biden and actually vote this administration out because specifically of its failure around COVID-19. One of the things that's very interesting in this article, which I thought was very interesting, when they talk about testing and all the problems with our testing, which other countries have better tests than we have. And the other thing that they talk about is when you look at how many tests we're performing, the number to really look at is how many tests are you performing in relationship to how many positives you have. And when you look at that ratio, our testing capacity is with other third world countries like Zimbabwe, Kosovo. We're very low in that regard. So this is a very interesting article to read. It's only about a page or two. It's not very long. All right, we're gonna go and add some Q&A. Let's see here. We're gonna stop the broadcast. Give me just a second to get back with you guys. All right, okie doke. All right, wonderful. All right, and we've got some questions already in the Q&A. So hold on just a second. Let's see what we've got. Okay, all right. let's see. All right, have you heard of any cases of COVID transmission from getting takeout food or food delivered? No, I have not. About the oddest COVID case that I've actually heard about is someone who actually got it from an elevator button in a apartment complex. But I have not heard of anyone catching it from takeout food or food being delivered. So no, I have not. Even though the risk is low, would you recommend not taking it if you don't have to? Even though the risk is right now, the test. Wait a second. Even though the risk is low, would you recommend? I think you were talking about. I think you were talking about takeout food. I think that's what you're talking about. If you want to send me a note and clarify, that would be helpful. But usually what I do is when I get takeout, I have them leave it on the ground. And then I do spray it with some cleaner before I bring it into the house. And then I immediately take all of the exterior paper off and put it into my own containers. And I get rid of all of their containers and put it into my containers. So that's what I do to actually keep my takeout safe. Okay. All right, great. All right. Okay. Okay, right now, the COVID test costs about $119. So to get two is expensive for some families. What can you suggest for folks who cannot afford the COVID test? I'm assuming you're asking about the COVID test. Yeah, so you only want to get two to actually confirm that you're negative. So what you can do instead is just, if you're positive, just quarantine for 21 days. If you quarantine for 21 days, in the study that they did in Italy, no one after 21 days was still positive. So a lot of people are not actually getting tested after quarantine to make sure that they're still not positive. We're in that conversation now. I think the president's doctor wrote a letter that he can go back to normal activities, I think Saturday. Well, ideally, you'd want to actually get the COVID test and actually confirm that he's positive. So, but if you can't afford the COVID test, I would just quarantine for 21 days. Oh, what countries have rapid testing? Okay, Australia, China. China has something where, like, you can just up on the street, you can go in, you can walk in, and you get your results right there. So I know Australia and China actually have rapid testing. At this point, I'm not exactly sure. I've even seen the rapid testing kits. I've seen some physicians have ordered them. And I saw them on the news, and they didn't want to turn the label around for us to actually see the label. But yeah, I don't know what we're doing, and that's part of the New England Journal of Medicine article. So a lot of the New England Journal of Medicine article was actually really about testing and how poor the testing is, and that you have to get the testing correct in order to actually get a handle on this. Alrighty. In late January, I had to rush my 11-year-old daughter to the hospital for severe asthma. She did not respond to normal treatment. They came in and did a swab of her sinuses. After that, they moved her to the ICU for the next 5 days, would not give us the results of the test or tell us why they were even doing that test. Since then, she still runs a fever almost every day with muscle pain and sore throat. Yes. We have been to several specialists, and as of today, they still don't know what's wrong with her. Do you think she could have had COVID and is still having long-term problems with COVID? So, so that is a possibility, yes. So a couple of things. You should be able to request her medical records and actually get a copy of the test that was done and to see whether or not it was a COVID test. So there are people that we call them, and they're calling them long haulers, right? And basically, they're people who have continued fatigue, sometimes continued fever, and for very long periods of time. And they're not really sure what makes someone a long hauler and what makes someone else not a long hauler. But I would actually see whether or not she actually got a COVID test. The other thing that you could do is you could actually see, I don't know if she was in the ICU, she most likely had a chest CT, a CAT scan of her chest. And you can see what the radiologist put on the CAT scan of the chest, because they're also reading them. And if they have the ground glass opacities, they're saying consistent with COVID. So the other thing that you can do is you can see, does she have antibodies? So you can do the antibody test, and that will let you know that she had it and has been exposed to it. And then that would also make it a possibility that she might that these might be related to COVID. If she's having muscle pains and sore throat and still running a fever, it'd be important that she sees an infectious disease doctor, right? So that's what I would try to get her into, an infectious disease doctor. Alrighty. And I hope she feels better. Is the new cure used on Trump actually worth something? So it's not a cure, it's a treatment, it's a therapeutic. And what they're talking about is the new cure, which is not a cure. They're talking about the monoclonal antibodies. So that is the antibodies. So normally when you get exposed to the disease, your body generates antibodies. So basically, they're giving him the antibodies, and that was thought to be a possible bridge to us getting to a vaccine. So that's basically, there have been really good results from that, supposedly, but they haven't been published yet. So what they did for using it for Trump is they applied for a compassionate use exemption because he's not part of the experimental protocol. With the experimental protocol, you get the antibodies or you get a placebo. So they applied for a compassionate use exception. They were granted that. And that is how he actually got the medication. So the other question that I have here is the rapid test in China. So China is actually doing a very good job with testing. They are testing large numbers of people quickly. So a lot of their protocols and their public health protocols that are in place actually are very good. So that's one area that they actually seem to be really good at. So, all righty. Wow, great questions today. All righty. Any other questions? All right, here we go. We got another one. Hold on. Okay. All right. Some churches, hospitals, and health centers do temperature checks before entering their facilities. Okay. How effective is that, especially when there's so much pre-symptomatic or asymptomatic spread? When I would assume, yes, when I would assume that no symptoms includes no elevated temperature. Okay, very good question. All right, so because of the amount of asymptomatic spread and pre-symptomatic spread, you're right. I think the temperature testing is giving people a false sense of security. I actually don't recommend it. And so I think that, again, temperature testing would work, is good for something like an airport or something where you're trying to really catch symptomatic people before they get on a plane. But I think that a lot of temperature testing, people think, well, because temperature tests, then everybody's okay. No, there's a lot of people who don't get a fever, as you saw with the clusters, with the 6 clusters. The first cluster is flu-like symptoms without a fever. And then other people transmit it and they're asymptomatic. And then other people transmit it and they're pre-symptomatic. In other words, they have COVID, but they haven't gotten symptoms yet. So because of all of that, I don't recommend temperature testing. I think it gives people a false sense of security. All righty. Let's see here. What else? All right. Yeah, you know, Mitch, I'm going to actually, we're going to figure out a way to get one of these tests. I'm going to figure out somebody who I know who's in one of these other countries so we can get one of these tests and figure out what they've got going on. I hear you. The testing is very, 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 very important. If we had a rapid at-home test, it would make all the difference in the world. All righty. Any other questions or Q&A? All righty. Okie dokie. Let's see here. I'm going to give it 1, 2, and 3. No more questions. No more Q&A. Everybody's got their questions answered. Just checking one more time here. All right. Okay. Sounds great. Well, I want to thank all of you guys for joining us today. We will be at it again on Tuesday. Be sure to invite any of your family or friends that are asking questions and wondering what's going on. One thing I think that I have seen is that, you know, people are paying a little bit more attention now, you know, now that, you know, there's been a lot of cases in the White House. People are really kind of paying attention and asking a lot more questions. And so people are seeing it as something that's really real. So join us next week. Feel free to share your invite with anyone that you'd like. And if you have any questions that you think about when this is over, feel free to email me and I will research the topic before Tuesday. All right, I want to thank you. Thank everybody for joining tonight.